So sir, this is the specimen of the heart, which we are keeping on the left dome of the diaphragm. Okay. So this is the apex. Always remember that the apex is placed on which
First wave space.
Left.
left.
First
First
wave
wave
space.
Okay. But in your in the
Fifth intercostal.
fifth intercostal space, right or left?
Left.
Left. Association with the mid clavicular line.
1.25 centimeter medial to the mid clavicle.
Yes sir, it is 1.25 centimeter medial to
Mid-
the mid clavicular line. Okay, so you keep it like this. Please hold it at this level. Kindly don't hear anywhere below or above. Please hold it here. No, we get people holding it here. पकड़ लो sir. But sir, as you are holding it, the first thing that you identify it, yes sir, this muscular part is nothing but is ventricular walls. So they are present anteriorly and a bit laterally. Whereas behind and medially, you have got the atrial part. Okay, so these are the posteriorly the atrial chambers. Now here you are getting two very important structures that are coming out. This particular structure is the pulmonary trunk that is coming up from the the right ventricle. It is coming up from the right ventricle, and then you have got this particular structure which we refer to as the aorta. So this portion that comes out from the left ventricle is the ascending part. Here goes the descending part. So sorry, my mistake. So this is the arch which starts and ends at the sternal level, or rather at the sternal angle. So vertebral level is T4.
T4.
It starts at T4, it ends at T4. It starts at sternal angle, it ends at sternal angle. So it commences from ascending aorta which ends at T4. It starts or continues as the descending aorta which starts at
T4.
Okay. Now, so from here we can identify the three vessels that will arise. So this one is the brachiocephalic trunk. This is the brachiocephalic trunk. This is the left common carotid, and this one is the left subclavian. Done. So this portion is nothing but the descending trunk. Now, here we will have to identify the borders. So this is my right atrium, and the right atrium, this is the atrium which has been opened up. So you're just closing it. As we close, we find this is the opening for the inferior vena cava, and then it is coming out through the superior vena cava. So this particular line is the right border of the heart, which joins the superior vena cava with the inferior vena cava. Now, from the opening of the inferior vena cava, if we reach the apex of the heart, this particular border is referred to as
Inferior border.
the inferior border of the heart. So inferior border of the heart, if you are holding it in anatomical position, basically lies on which aspect? It is present on which aspect, means which side?
Right side.
Present towards the
Right side.
So the right border, SVC, IVC. From IVC, go to the apex. Inferior border. Now from here, you have got two things to do. From the apex, try to come towards the left auricle. From here, if you come to the left auricle, you will go along what is called as the anterior margin. And then from the apex, if you try to go along this surface where the border is not very prominent, okay, this is basically the innominate border, or also at times referred to as the left. So, idea number one, SVC to IVC, imaginary line, the right border. IVC to apex, inferior border. Apex to left auricle, anterior border. Apex, and then go along this side, that is the left side, is the innominate or the left border. Clear? Those are the borders. Now, if you are talking about the surfaces, then definitely this is my anterior border, this is my inferior border. So this particular surface comprised primarily of the right ventricle and a small part contributed by the right atrium. So this is the sternocostal surface. Between this innominate border and the anterior border, this particular surface contributed entirely by the left ventricular wall is the left surface. if we are talking about this surface, which is actually going posteriorly, because I'm holding the heart like this, so this particular surface is going posteriorly. So this particular surface shown in this manner. We will always show it in this manner. So if I am holding, if I am the examinee and you are the examiner, the heart lies like this. I keep my hands like this. And then I slowly turn the heart, that is the base of the heart or the posterior surface of the heart, towards my examiner. Never ever make the mistake of taking the heart like this, doing it like this and then showing it. Your marks will be deducted. Okay? Heart remains in its anatomical position. You put your fingers on the posterior or the base and then just rotate your hands to show the examiner the posterior surface of the base. Clear? Now, after showing the base, sir, you are constantly resting the heart on a surface which is on the diaphragm. So this particular surface is diaphragmatic, or in other words, inferior. So inferior surface, left surface, sternocostal surface, and the base of the. Clear? We have already identified the rest of the structures. So from the posterior aspect, as you are seeing, so this is the cavity of the right atrium and this is the cavity of the left atrium. Okay? If we can go inside, we will be seeing things. Now, there are two more things that are present here which are called as the two sinuses, the transverse and the oblique. So oblique sinus is nothing but present on the base. Okay, so you just show that you are going to insert your finger from below upwards. Okay, don't put it like this. To show the oblique sinus, what you do is, the oblique sinus is present in this direction because it is closed in the upper part and it is open in the lower aspect. So you just insert your fingers, you just insert your hand like this. So the direction of your finger goes up like this. Clear? So that is the oblique sinus. Now the transverse. Now as you know, the transverse sinus basically divides the aortic valve. Is it? So this arterial and venous is basically in association with the structures that are entering and the structures that are leaving. So basically it is the part that is present between the ascending aorta, the pulmonary trunk anteriorly, the SVC and the pulmonary veins posteriorly. So here is your transverse sinus. Here is your transverse sinus. Okay? So you are just going to hold the arterial ends anteriorly and the venous ends posteriorly, and in between you will be finding the transverse sinus. Clear? Now, if we go to the inner aspect,